Good morning, I'm Dr. Wall from Barnesville Chiropractic and Fitness Center. Welcome again to another edition of our Health and Wellness Talks. Today we're going to talk about preventative care. Now most of you have heard of preventative care, but I want to get into a little more detail as to what true preventative care is and what it can do for you. Now, in theory, preventative care is anything that helps our overall health and wellness and prevents health problems down the road. So when we look at examples of preventative care, I always talk about exercise or a healthy diet. Eating healthy on a regular basis, more vegetables and fruits than refined products, will make you healthier long term. And research has shown that it will prevent things like diabetes, heart disease, high blood pressure, obesity, those types of things. So it's truly preventative in nature to eat a healthier diet. Next thing is exercise. People that exercise on a regular basis, not aggressively, but 20 to 30 minutes, 5 days a week, have been shown that they have less chance of developing diabetes, heart disease, cardiovascular problems, those types of things, and that is truly preventative in nature. So, when we talk about preventative care from a chiropractic standpoint, we talk about treating a patient prior to them having any conditions, not just prior to symptoms. So that's the difference between true preventative care and just preventative care. So a person comes into my office, 99% of the time when people present to our office, it's for a specific condition. A neck pain, a headache, a knee pain, carpal tunnel syndrome, shoulder problems, whatever it may be. So that is not preventative, it's reactionary in nature. So they're reacting to a pain. But most of us, 20 years and older, how were we raised? We were raised in a society where we went to the doctor because we had a problem. We weren't educated to do preventative care. So in our office, when we have people present with conditions, we help them through their condition, through rehabilitation, chiropractic adjustments, and active care plans in our office. Some people with low back pain, it may take 10 to 15 visits over the course of 4 to 6 weeks, and rehabilitation at home to stabilize their condition. Once we stabilize their condition, then we talk to them about preventing it from coming back. So preventing it would include them doing their regular stretches and exercises and stopping in and doing a preventative adjustment. That would be coming in here when they feel well to get an adjustment to make sure that the spine and all the other joints in the body are functioning optimally. An example of that would be if a person has tightness on the left side of their low back because their job requires them to turn to the left all the time. Well, when that tightens up on the left, it causes a pressure on that side of the spine and eventually will lead to muscle spasm and pain, or it'll be subclinical, not painful, and the joint will jam and it will break down faster. So when they're 50 years old, they have arthritis and degeneration in that side of the hip or pelvis. Well, those are the things we want to prevent. If we prevent the muscle from tightening up, prevent the joint from jamming, we're going to prevent the wear and tear that occurs in those areas. So when a person is done with their active care in our office, we talk about them coming in on a monthly basis to get a preventative adjustment. Now, once a person changes their thought process on how to treat their condition, not just take care of pain, then they truly become healthier, because when they come in the office, not only are we realigning the spine and reducing the muscle tension that's putting pressure on their spine, causing their condition, we also have the ability to talk to them about exercise, nutrition, and healthy lifestyle habits. Now, some people, when they come in and I start talking about preventative care, are skeptical in the fact that, oh, this person just wants to see me the rest of my life. And in truth, I do want to see them the rest of their life because that's the only way to prevent spinal problems long term. People should be able to reach 85, 90 years old and be active and healthy without a lot of pain. But it takes work and it takes time on a regular basis to do that. Now, the skeptical person will come in and say, well, boy, he just wants to make more money out of me by seeing me more. And when I explain to the patient that it's actually more cost effective to see them monthly than it is to treat the flare-ups, cost-wise, that's when they understand that our goal in our office is not only to help a person become healthier, to do it in a cost-effective manner and make sure that the patient is always the number one concern and that their health is their number one concern so we can help them live a long, healthy life. So, if you've never contacted your chiropractor about preventative care or haven't been instructed on it, stop at our office and talk to us about preventative care, and we can set up a plan on how to prevent all those conditions that people live with as they get older and help them live a longer, healthier life. Have a great weekend, enjoy your health and wellness, and get outside and get some exercise. Have a great weekend.